Welcome back to 41 Today Lifestyle, everyone. I'm here with Dr. David Cohen, and we're from Skincare Physicians of Georgia. We're talking about a position and a conversation when it comes to injectables. A lot of people get it wrong, so we wanted to get to the nuts and bolts. Welcome to the show, my friend.
Thank you.
Okay, let's break it down for everyone sitting at home. What are injectables to begin with?
So injectables are things that are placed in parts of the face or parts of the body to cause tissue expansion or aesthetic improvement in a particular area of the face.
It's interesting you just said body, because injectables have come a long way in the last maybe 5 to 10 years, and I see it now being put into the knees, around the ankle area. It's amazing with what you can actually do now with it.
We're happy that so many are unhappy with the way they look, that they're willing to do things that are a little bit out of the normal realm.
I agree. If you're unhappy, get it injected, I say. What's the difference between toxins and injectables?
So I don't like the word toxin because it sounds toxic to an individual. It sounds like the original reason they called Botox and Dysport toxins is because they're derived from a bacteria, but it's a protein that the bacteria makes that causes muscle relaxation.
Now that's what everyone should know as Botox, or
yeah. So there are a variety of Botox was the original and has the name recognition like you know in advertising, but there are several other toxins that are on the market as well that perform well equally.
Okay.
And so it's a protein that's injected into a muscle, and it causes the muscle to relax. If that muscle was pulling on your skin and creating a crease, it releases the crease and it relaxes.
Oh, I like that idea. What's an injectable?
So injectable means it's put in with a needle.
Okay, all right.
Just
who's the
simple as that.
perfect candidate then? Let's talk about that.
Well, you know, as people age, women and men, I find that a lot of people lose volume in their face. If you look at a picture of yourself when you're 20 versus 50, and you really analyze it, you'll see that your cheeks aren't plump.
But
like
should
they
we
used
really
to
be looking at those pictures?
Sure, sure. But if you're trying to realize what aging is, so a 20-year-old has the nice, big, puffy cheeks with fat pads, and as you get older, the fat pads diminish and you start to look sunken in. People always talk about the jowl or the crease here, but the jowl and the crease are not the problem. The problem is the volume and the fat that went away, and it drops.
Okay.
Right.
I love it.
And the problem I have with some people who go in and have a surgical procedure like a pullback is they're not recreating the volume in their face. So they look like they're pulled back, like we see some of
But they've lost the texture and the volume.
and the three-dimensionality.
I didn't think of that. That's a great explanation. I like that. Okay, what makes you the perfect person for me, the patient, to come and see?
So
how do you find that right provider?
I tried to look at the face naturally and not overdo it. We've all seen people in public who you can tell they were injected. And that's the last thing you want, that anybody know you had it done. You want to look good, but you want to look natural.
I got you.
And so I focus on the things that can either make you regrow back collagen or add the volume back just in the right amount where you don't look like you go in the public eye and people go, that lady had her lips injected or that lady had her eyes done. That means it wasn't done naturally if you can see it.
How do you feel about, once I've come in as a patient, can I come back in a few weeks' time if I feel I need a little bit more of a top-up? Or I say, Dr. David, I just feel I need a little more.
Sure. It's always good on a new patient who's new to cosmetic arena to check back on things. I like to go slow. I always tell people it's like redecorating a room. You might go in there and change the color of the walls and then come back and say, well, I don't think the curtains quite match right now, and maybe we'll tweak that a little bit. So especially for a new person, I don't like to do too much the first time.
All right, Dr. Cohen, as always, great information. We really appreciate it. Looking forward to more if you want to find out more information about Dr. Cohen and Skincare Physicians of Georgia. All that information is up on your screen now. Give them a call. They'll be looking forward to seeing you very soon. Back after this short break, everyone. You're watching 41 Today Lifestyle.